Is there someone from the LEO's office who's prepared to present stakeholder proposals?
Yes, Mr. Chair.
You're looking at me. I'm not going to present it, but
Okay.
I think we're better off if you present them. Thank you.
So, as the agenda notes, we've been asked to present some stakeholder proposals, and as you probably know, we haven't actually analyzed or formally looked into these proposals, so we don't actually have a position or recommendation at this time. We're just presenting them. So, the first proposal would restore optional benefits in the Medi-Cal program that were eliminated in the 2009 budget for an annual cost of $108 million. The next proposal would provide funding for caregiver resource centers for an estimated cost of $7.6 million. The next would limit estate recovery in the Medi-Cal program to only those healthcare services that are required to be collected under federal law, and would use a narrow definition of estate, and also allow for a hardship exemption from estate recovery for a home of modest value for an estimated cost of $27.5 million. The next proposal would increase the amount of income that is disregarded for calculating eligibility for the Medi-Cal Aged and Disabled program, raising the income standard from 123% of the federal poverty level to 138%. Next is a proposal to provide a rate increase for the AIDS Medi-Cal waiver program for $4.8 million. The next proposal would revise the Medi-Cal and family pack reimbursement formula for drugs dispensed by certain clinics by requiring the dispensing fee to be the difference between the actual acquisition cost for the drug and the Medi-Cal reimbursement rate for an annual cost of $6 million. And finally, the last proposal would provide funding for the Robert F. Kennedy Farm Workers Medical Plan for an estimated cost of $2.5 million.
Thank you. Any questions from the committee on the stakeholder proposals? Mr. Chu.
So I understand at this time you don't have any initial perspectives on this. Could I just get an understanding of the process by which you go about thinking around priorities with various stakeholder proposals, and how, for example, this committee can feed into your thought process?
Certainly, Mr. Chu. As an office, we recognize that proposals are sort of going to be a function of, in terms of which ones are given, sort of in terms of I guess, assessing all proposals, it really is a function of what resources the state's looking at, and with the release of the May revise, as looking across the state budget and across programs, not just in health and human services, but in other areas, we would encourage the legislature to have a debate about the viability and the competing priorities across different departments and programs.
I think I would just make a couple of early comments. Certainly, I think we're all hopeful with the May revise. We will have some additional funding to address a number, if not many, of these proposals. From my perspective, certainly restoring some of the optional benefits, I think I've certainly heard from many of my constituents, would be something that would be greatly appreciated and needed, certainly in the adult dental area. And I would say, with regards to my constituents in the area of acupuncture, we know that acupuncture is an area that not only provides very effective services, but very cost-effective services. I'd also be hopeful that with some of the proposals regarding AIDS waiver rate differentials, as well as some of the drug billing around 340B clinics, that there might be some ability to address them, as well as some of the eligibility increases for our aged and disabled. But look forward to working with this committee as well as your office, and trying to figure out, after the May revise comes out, what we are able to spend for.
Thank you, Mr. Chu. Mr. Bonta.
Just want to second the interest and support for restoration of acupuncture as an optional benefit.
Thank you. I see. Please continue.
Thank you, Mr. Chair. Yang Lee with Department of Finance. I just want to know that these are not the administration's proposal, so they're not included in the governor's budget. So as a result of that, we're not
yet, right?
So as a result of that, we're not in support of these proposals at the moment. Thanks.
Well, we'll wait. We'll be looking forward to it, and I echo the sentiments of my colleagues that these are worthy proposals. Certainly, the adult dental, we've heard many stories about how, especially those who require special services, people with developmental disabilities need those services, and considering other ways to support our clients and our constituents around health, around acupuncture. we certainly think that they are worthy of reconsideration. So we'll look forward to the governor's proposals shortly. I see we have a line of speakers for public comment. We'll ask you 30 seconds, state your name, your affiliation, and which item you're speaking on and your position.
Thank you. Good afternoon, Mr. Chair and members. I'm here today on behalf of SciMed Corporation to urge restoration of optical lab benefits that would mainly apply to new adult Medi-Cal beneficiaries whose benefits draw enhanced federal funding up to 100% of Medi-Cal, 100% under the ACA. Restoration would end a catch-22 for these non-disabled adults under age 65 with incomes under 133% of federal poverty level. Now under Medi-Cal, they can obtain routine eye exams and prescriptions, but not the eyeglasses. That's the catch-22. So please restore it so they can find jobs and lead normal lives.
Thank you.
Linda Way with Western Center on Law and Poverty. We support restoring all optional benefits, but would like to note the need for adult dental. In regards to estate recovery, we want to thank the subcommittee for for considering this proposal. We believe this is a critical equity issue as it only impacts the poorest Californians, those on Medi-Cal. In relation to increasing the Medi-Cal aged and disabled program level to 138% of the federal poverty line, we believe this provides parity and relief for low-income seniors who, but for their age, would qualify for free Medi-Cal. And those are our three items we'd like to say.
Thank you.
Tam with Health Access California, ditto with what my colleague at Western Center said. And we support the restoration of all the so-called optional benefits, but particularly full adult dental. And we just want to bring the committee's attention to a study that was just published in the Journal of Health Affairs that found that California emergency departments experienced a hike in visits for dental issues in the 2 years after comprehensive dental benefits for adults were cut from Medi-Cal. We also support limiting Medi-Cal estate recovery, and that's particularly important here in California because of our reliance on managed care, which means that literally for every month that someone over the age of 55 is enrolled in Medi-Cal, the full value of the Medi-Cal managed care capitation payment is a lien on the estate. And we also support the eligibility increase for the aged and disabled. Thank you.
Thank you.
Good afternoon. Craig Pulsfer from AIDS Project Los Angeles, here to support provider rate increases in the AIDS Medi-Cal waiver program. This program is currently in crisis. Provider reimbursement rates are so low, it's impossible to operate the program without losing money on every patient that comes in. According to an analysis from DHCS, the rates in this program are up to 58% lower than rates in other waiver programs for the exact same services. We were told by DHCS these would be increased in this year's budget. That won't be happening. So we're currently working with the legislature to address this rate disparity.
Thank you.
Thank you.
Scott Singer. I'm a provider from AIDS Project Los Angeles, and the AIDS waiver program is what I'm speaking about. The AIDS waiver program is a safety net program that people are now not able to access. We've dropped from 44 programs down to 26 in the state of California. The providers don't have enough money to provide the services. They don't open up the programs because you just lose money. So we are urging you to please consider a rate increase so that we can keep this vital safety net program going. It's an entitlement.
Thank you.
Good afternoon. Diane Giorgetti with Westside Community Services, a nonprofit that provides nursing and social work support to AIDS clients living with AIDS. I'm supporting the increase in the reimbursement rate for the program because on a day-to-day basis, I work with the most disenfranchised, frail, and sick clients in San Francisco. We're the last Medi-Cal waiver program that exists in the city, and in the face of the housing crisis and increased health problems with aging and other complications, we are running with nurses who are underpaid, we're understaffed, our caseloads are maxed, we are completely under-resourced and trying to pick up the pieces. Thank you.
Ellen Santos. Good afternoon, Mr. Chair and members. I'm here in support of the from ARC Staffing Home Care AIDS project here locally in Sacramento, and I'm here to support the proposed reimbursement rate increases for the Medi-Cal waiver program. We are having difficulty in finding agencies or staff that will provide the services for our clients, and therefore, these clients are not being serviced at this point. Thank you.
Thank you.
My name is Susan Farrington. I'm the Executive Director of the Sierra Foothills AIDS Foundation. We provide Medi-Cal waiver and other comprehensive support services for people living with HIV and AIDS in Placer, El Dorado, Nevada, and Alpine counties. I'm here to speak for all of the agencies providing Medi-Cal waiver services in Northern California to let you know that without these rate increases, some of my colleagues running other programs will be forced to close their programs, leaving these clients without services. We lose money on each and every client that we serve, and as committed as my agency is to continue to provide this level of care, it does have to be supplemented with private funding. Thank you so much for your consideration.
Good afternoon, Chairman and members. Paul Neprath on behalf of Planned Parenthood Affiliates of California, 115 health centers throughout the state. We're here in support of the proposal on drug billing for 340B clinics. This is a really critical program for not only Planned Parenthood health centers, but other clinics throughout the state. This particular proposal will simplify the billing and reimbursement system for community clinics for the drugs and supplies that they dispense on-site at these health centers that are so critical to access for low-income men and women throughout the state. Thank you.
Thank you.
Chair and members, Kathy Mossberg, I want to go on record on behalf of the San Francisco AIDS Foundation supporting the increase in the rate for the AIDS Medi-Cal waiver program, as well as on behalf of the California Family Health Council supporting the drug billing modifications and simplifications for 340B clinics. Thank you.
Thank you.
Mr. Chair and members, thank you, Megan Allred, on behalf of the California Dental Association, and we appreciate your support on the adult dental restoration. CDA believes that all adults should have access to comprehensive dental care, but we'd like to focus on fixing the currently broken system with rates some of the lowest in the country and access to care being a giant problem. Adding more covered services without taking steps to address these issues is only going to exacerbate the issue or the problem. The state should be looking at ways to increase access to care. There are many strategies that can help this, and increasing provider rates really needs to be a part of that discussion. Thank you.
Thank you.
Chair and members of the committee, I'm Patrick Pine, Administrator of the Robert F. Kennedy Medical Plan. The plan ensures 13,000 lives, including farm workers and their eligible family members. The plan has made all adjustments to ensure compliance with the Affordable Care Act. With the farm workers' request this year of $2.5 million, and with applying the Department of Health Care Services and University of California metrics, the net savings to the state's general fund should be $4.13 million. Thank you for your consideration.
Chair and Member Sean South on behalf of the California Primary Care Association. We strongly support the 340B simplification and billing proposal. We believe that the Medi-Cal estate recovery needs to be dealt with in the budget as the governor instructed us to do. And finally, we believe that all the optional benefits should be restored. Those patients have gone too long without needed preventive services. Thank you.
Thank you.
Good afternoon. James Chang, licensed acupuncturist. I'm here to represent the American Association of Chinese Medicine and Acupuncturists. We have 800 members. I'm here to state my support of reinstating Medi-Cal coverage for acupuncture. Thank you very much.
Thank you.
Good afternoon. There is Jun Hu is in American Association of Chinese Traditional Medicine and Acupuncture Vice President. We have almost 900 in the acupuncturist member. So we suppose the restore and the acupuncture benefit back into Medi-Cal. Thank you.
Thank you.
I'm the licensed acupuncturist. I'm here to support the medical coverage in the acupuncture field. Thank you.
Thank you.
Hi, my name is Kathy Kelly, and I'm Executive Director of Family Caregiver Alliance and the National Center on Caregiving, and we are also run the Bay Area Caregiver Resource Center in San Francisco. We're talking today on behalf of the 6 million family caregivers who are really the long-term care workforce for the state of California and restoration. A request of $7.6 million that was cut in 2009. Family caregivers are providing practical support and really are the backbone of the long-term care system. Their economic value far exceeds anything in the public sector.
Final comments, please.
$4.7 billion. And we asked for this realignment of funding so we can continue to work in the home and community-based service market with all of the different kinds of programs and initiatives that are underway in the state of California. Thank you.
Hello, my name is Kathy Spain. I'm a family caregiver, and for the last 2.5 years, I've been caring for my parents. My dad, this past March, passed away at the age of 100 in his bed at home, peacefully, with my mom next to his side. If it wasn't for Valley Caregiver Resource Center, I could have never accomplished this. My dad was able to go to Oasis Daycare Center, which was such a blessing to our family, to have those hours to be able to do things we needed to do because his dementia didn't enable us to even go on simple errands. They also gave me knowledge and support that was unbelievable through the workshops and the programs there. I learned how to deal with his dementia, how to communicate with him. It was such a difficult task that I had no idea how to do it. My mom is now 103. I will continue to live with her so she can stay in her home. She has been in for the past 73 years, and she's starting to get some early signs of dementia. But I know with the help of Valley Caregiver Resource Center, I'll be able to stay with her also. I strongly support the funding for this organization so they can continue to help family caregivers like myself. Thank you.
Thank you.
With Valley Caregiver Resource Center in support of restoring the Caregiver Resource Funds. Valley Caregiver Resource Center help families, enable them to keep their loved one at home as long as possible, deter early institutionalization where it's needed. Our goal is to provide families with skills and tools necessary to help their loved one at home as long as possible and to connect them into community resources. Again, I would like the committee and Chair to support the restoration of the CRC funds.
Thank you.
I'm Barbara Crystal from Fresno, California, and I'm here also to support the restoration of the Valley Caregiver Funds. I'm speaking on behalf of my mother, who is 92 years old, and on behalf of so many other mothers and fathers throughout the state of California. I think this is a cost-saving kind of thing because, especially in the case of my mother, it allowed us to keep her at home following the time that she fractured her pelvis in 3 places. With a little bit of assistance, I, who am 68, had a knee replacement and a hip replacement during the period of time in the last 3 years or so that Valley Caregiver have been assisting me. My mother has just in the last couple months had 2 surgeries, not big drastic ones, but the kinds of things that allow, with Valley Caregivers assistance, me to keep her in her own home where she deserves to be. Thanks.
Thank you.
Victoria Molina, Fresno. Caregiving for my 85-year-old mom and cared for my 87-year-old dad for 3 years, who was severely disabled, but he's passed. And Valley Caregivers has always been there for me with resources in our areas and helping me be able to care for my parents through trainings and workshops that they offer, and just being there for us by phone whenever we need them. And I strongly request that funding get fully restored so that they can continue to help us. Thank you.
Thank you.
My name is Nancy Baker. I live in Moraga, California, which is in Contra Costa County. And my husband had Alzheimer's for 5 years. And the Family Caregiver Alliance allowed me to, they have respite weekends when you have a weekend off and your loved one is taken care of. And I took classes that really helped me. And they got me a free appointment to an elder law. And I guess the thing that I most want to say is that the Alzheimer's Association is really involved in research, and the Family Caregiver Alliance is in helping the caregiver, and there's not a lot of that out there in helping the caregiver, and it gets lonely, and there's a lot of us.
Thank you.
Good afternoon. My name is Karen Bruner, and I'm from Sacramento.
I'm here today to ask for the restoration of funds to the Caregiver Resource Centers. The face of caregiving today is changing, and I am now the face of it. I'm sandwiched in between trying to raise my own young family as well as care for my aging parents, one who's already been passed away. The addition of these funds to the CRC budget will go directly to the communities and caregivers like me, caregivers who are overwhelmed and scared, who these funds provide us support and resources to get through the day. In the final year of my mom's life, Del Oro Caregiver Resource Center was the lifeline that enabled my father and I to get through each day, to have the backup plan where we started with Plan A but made it through Plan Z. I've learned that things never go as planned, but by offering programs through the CRCs to family caregivers, everyone benefits. The caregiver, the receiver, the patient, the family, employers, and the community. If you restore these funds, 6 million California caregivers have the chance to rewrite our stress story and lose some of the fatigue that causes years off our lives. Thank you.
Thank you. I'm going to ask speakers, just state your name, your affiliation, and the position that you want supported.
My name is Rick Rayburn. I am from Sacramento. I'm the sole caregiver for my wife who has serious dementia, and we really depend on the Del Oro Regional Care. I really depend on the Regional Del Oro Caregiver Center, and as a result of the assistance they provided me when she first really became totally delusional, with some temporary assistance provided direction for me to how to spend my money now to care for me so I can care for her properly. So it's a wonderful organization. I'd ask that they be funded. That'd be great to give them back the 75% that was cut, but they need the funding. Thank you.
Thank you.
Good afternoon. My name is Amanda Jackson, and I'm the mother of these two lovely young ladies, Zoe and Sophia. Hi, girls. I'm the sole full-time caregiver for my mom, Joanne Jackson. And since 2009, when we moved in together, 3 months later, she lost her ability to walk. She's a retired school teacher, currently being treated for ovarian cancer as well as advanced stage Parkinson's disease. My mom is completely dependent on me, much like a young child. She needs to be clothed, bathed, changed, fed. She cannot be left at home alone. She needs me to manage every aspect of her life, from navigating her health care needs to overseeing her finances. Therefore, I am not able to work outside the home. I am not paid to provide this care for my mom, although it is technically a 24/7 job. The care mom requires is not covered by insurance, and unfortunately our family does not qualify for IHSS. Caring for 2 generations can be extremely taxing. Getting the girls to school and soccer practice one day and mom to chemo or the doctor's office the next, making sure to schedule each activity so one does not conflict with the other. This is why I can say without hesitation that I could not continue to care for my mom effectively without the support of Del Oro. Del Oro provides the sanity-saving services that are crucial to my well-being. Through Del Oro, I have the support of a social worker who calls monthly to check on us and comes by our home every few months for a visit to see how we are coping, to ask what we need, and to find the resources to fulfill those needs. And most importantly, just to listen. Del Oro provides to us free of charge that much-needed respite. For a few hours each week, a caregiver comes to the house to clean, cook, bathe my mom, and I cannot tell you what an utter relief this has been. As our loved ones age, many of us will be faced with similar challenges. I hope that I have helped you to understand why Del Oro services are needed. They are life-changing and life-saving. We all depend on them. Thank you.
Thank you.
Have a nice day.
I'm Christina Andrad, and I'm a family consultant for the Delmar Caregiver Resource Center, which covers San Benito County, Monterey County, and Santa Cruz County. I just want you guys to take into consideration that the decrease in these funds has added to things like people using up all their money, so then they have to go on Medi-Cal and go into skilled nursing facilities. It has added to the stress and the burden of the caregiver and increased things like elder abuse in the communities because they cannot get the rest and the break that they need from the task of caregiving a loved one.
Good afternoon. I'm Jack Light. I'm the Associate Director of the Caregiver Resource Center, Orange County. I'm here in support of fund restoration for the Caregiver Resource Centers. Our agency has been in place since 1988, serving approximately 60% of our client population who are working part-time or full-time while caring for their loved ones, as well as helping their loved ones navigate the healthcare system, reducing a lot of additional costs that would otherwise be expended because they were not able to.
Hello, I'm John Balutz, Executive Director of Health Project Center and the Director of the Del Mar Caregiver Resource Center. I'm here to ask you to please restore the 74% that was cut from the Caregiver Resource Centers so that we can continue to keep people at home, which saves money and keeps families intact. Thank you.
Marianne DeWar, Chico, California. I live with my husband, John, diagnosed with Alzheimer's 3 years ago. In addition to all of the eloquent comments you've just heard, I would like to add that the Caregivers Resource Center in my area fosters a fabulous support group for people who have loved ones at home, caregivers of all sorts. And their rage, frustration, anger, tears, stories of incredible sadness are exchanged for comfort, sympathy, validation, affirmation, and sometimes outright laughter. It's a wonderful thing, and we need to have all of the services restored as soon as possible. Thank you for your interest and in hearing us.
My name is Fred Stevens. I'm a licensed clinical social worker. I'm a contract worker with Redwood Caregiver Resource Center in Santa Rosa. I've been with the agency for around 13 years. I went to work for them after Redwood Caregiver Resource Center and Hospice of Napa Valley gave an amazing amount of support to my aunt at the time of my uncle's death. And I admire the agency so much that I sought out to work for them. But my point here right now is I'm requesting that the agency be refunded at its previous level, as this request states, because although I went to work for the agency because of my admiration for the work that they did for my aunt, when it came time that my own parents developed serious disabilities, the Modesto office was closed down because of the shortfall in money. This not only impacted my sister, who was providing the in-home care for my parents because she wasn't able to get support groups and other emotional support that the agency provides. She ended up having to take a tremendous amount of time away from her job, which ended up impacting her retirement, which meant she had to extend out further as within her system and delay her retirement, yet at the same time is in this sandwich position of taking care of grandkids and taking care of my parents. I'm not able to help out because I'm working, and I go over on weekends, take care of my parents, which means I'm working 5-7 days a week in order to make sure that my parents receive adequate care. And it's not just happening to me, because my ex-wife, her parents also found themselves in that same position. She's a doctor over in Modesto, and her sister is an executive manager for a welfare department. And even with all of the resources that they've got, they tried to keep their father at home, but with no support services, they had to quit. So once again, I hope that you're able to see yourself clear to move forward on this.
Thank you.
Good afternoon. I'm Nina Weiler Harwell with AARP California. These are stories that we hear every day, so we are here to strongly urge the committee to restore the funding for these centers. This is an important investment in the future of the state, where we know the number of available caregivers is going to decline significantly. At the same time, the number of our older adults increases significantly. So this is on behalf of the millions of family caregivers performing a labor of love, whether in the past, present, or future. We do urge you to restore this money.
Good afternoon. My name is Melanie Rager. I'm from Santa Cruz, California, and I work with caregivers through the Del Mar Caregiver Resource Center, which serves Santa Cruz, Monterey, and San Benito counties. I'm here today to ask you to restore the funding for the Caregiver Resource Center programs, and I'm here on behalf of all of our caregivers who can't be, because they are working in the community in a critical role that is really the backbone of our long-term care. Thank you.
Hello, Carmen Estrada from Inland Caregiver Resource Center. We cover San Bernardino, Riverside, Inyo, and Mono counties. 40,000 square miles that we have to cover. We There's just not enough funding for it. I want to leave you with one thought, as quoting Rosalind Carter, who stated, there's only 4 types of people in this world: people who are providing care, people who need care, people who will be providing care, and people who will need care. And that pretty much covers all of us. So caregiving is a part of our lives. It's going to reach all of us at some point. It's important for there to be sufficient funds to support our programs. Thank you.
My name is Mary Sheridan from Coast Caregiver Resource Center, covering Santa Barbara, Ventura, and San Luis Obispo counties. And I want to thank you for considering the profound effect that a relatively small investment has, not only on lives, but also on the bottom line, as the Caregiver Resource Centers help families keep their loved one at home, avoiding costly rehospitalizations and nursing home placements. Thank you.
And I'm Michelle Nevins. I'm the Executive Director of Del Oro Caregiver Resource Center, serving 13 counties, too many to name. Just a quick reminder that we received a 74% cut back in 2009, which is one of the largest cuts to health and human service programs. In addition, I just wanted to speak on behalf of the number of caregivers that we are unable to serve because of the funding cuts that we've sustained, and turning those folks away is heartbreaking.
Good afternoon. I'm Alexis Glidewell. I'm a family consultant, social worker at Redwood Caregiver Resource Center that covers 11 Northern California counties. And I'm here to urge the committee to vote in favor of restoring funding for the Caregiver Resource Centers. Thanks.
Hi, my name is Maisie Nguyen, and I'm a student intern at Redwood Caregiver Resource Center. I've been with them for about 2 years, and I've worked with caregivers who are as young as 20 years old, who have to put their lives on hold, their education on hold, just to be a family caregiver. And so please give your support to restore funding for Caregiver Resource Center so we could provide support for the family caregivers. Thank you.
Good afternoon. I'm Nancy Powerstone. I'm the director of Redwood Caregiver Resource Center, and I would just like to ask you to please restore the funds that we lost in 2009. I serve, my program serves 7 Northern California counties, a few of them that are very rural and some frontier, and folks don't have a lot of services. We've had to close offices, like colleagues have had to do also, and there are many, many people who can't be here to talk to you themselves because they don't have the support or the help for their folks at home.
Good afternoon. I'm Lori Van Tilburg, and I'm the Executive Director of Southern Caregiver Resource Center, serving San Diego and Imperial County. I started the agency almost 29 years ago, and our budget back then was more than it is now, so I think that shows the decrease that we've had in our funding. In addition, we spend a lot of time talking about managed care here and the health plans and trying to keep people out of the hospitals as well as the nursing homes and the emergency rooms. The people that manage those individuals' care are the caregivers, and without the support from the Caregiver Resource Centers, people will continue to go into the nursing homes, they will continue to go to hospitals, and they will continue to go to the emergency. So please support the Caregiver Resource Centers. Thank you.
Good afternoon. My name is Joe Cobery. I'm the Executive Director of Passages. We serve older adults and family caregivers in 10 rural Northern California counties. I'd like to encourage the support of the Caregiver Resource Center system and echo the thoughts with the managed care system that's being implemented in California. This is the exact type of program that complements the services. It's an efficient way to deliver services to the community. Thank you.
I'm Nancy Conchandani. I'm a family consultant with the Mountain Caregiver Resource Center. We cover 9 of the counties up into the frontier area, and I would request that you can restore the funding for our program. Thank you.
Hello, my name is Michelle Venegas, and I am the Director of Programs and Services for the Family Caregiver Alliance at the Bay Area Caregiver Resource Center. I'm standing before you today because as the diagnoses of Alzheimer's and other dementias continue to rise, the reliance on family caregivers providing care will obviously increase. When I say care, I'm talking about transportation, to and from medical appointments, giving medication, preparing meals, injections, wound care, feeding tubes. Now, I'm not talking about nurses here. I'm not talking about certified assistants here. I'm talking about family caregivers, bathing, toileting, filling prescriptions, companionship, ensuring safety in the home, and dealing with piles and piles of paperwork from hospitals, insurance companies, and other providers. We, the 11 statewide caregiver resource centers, provide comprehensive in-home assessment, educational workshops. We provide respite retreats and respite grants, legal consultation, counseling and support groups. I urge you to vote to restore full funding levels to the California resource centers. California families deserve and need these programs and services. Respectfully, thank you.
Christina Irving with the Bay Area Caregiver Resource Center. The CRC system is a huge part of the long-term care services and supports in this state. We get a lot of referrals from hospital discharge planners, medical social workers, adult protective services. So restoring the funding allows us to better serve caregivers and work with the larger system of long-term care needs. Thank you.
Thank you. See no more public comment. Any comments or questions from members? Okay, seeing, we're going to go to DHCS issue number 3, Assembly Member Proposals.